Hello all, in this short little video, I'm going to take you through the latest updates to the Women's Health Database, specifically the new options that have been added that relate to the Pathways project. So these new options your staff will be using when they input data related to strangulation and sexual choking. And that will happen the moment you implement your protocol and referral pathway. Okay, so what I'm going to do is I'm going to first take you through the new categories that have been included. Then we'll move to the Women's Health Database where, using a fictional character, I will show you how we can input that data. And then finally, at the end, we'll have a little look at a report. And so I can show you the information that we can get from this data. So what I'll do is I will share my screen with you now. Okay, so you can see in this Word document that we added new options to the two categories. So presenting issues and services provided. So in the presenting issues, you can see under the physical injury that we added traumatic brain injury and acquired brain injury. And just a reminder that this is self-reported. At no stage do we ever need a woman to provide evidence that she has a diagnosis of a brain injury. Under violence, we have added strangulation, suffocation, or choking. And then under relationships, we have added sexual choking. In the services provided, we have also added screening and assessment for sexual choking. We have added screening for sexual violence. Domestic violence screening was already in the database, so we didn't need to add that one. And then we have also added screening and assessment for strangulation, suffocation, / choking. So these are the new categories that have been added. Also, a little side note, these numbers on the side, they don't relate to the number in which they are within the reports that come out of the database. Okay, that's just the number that we've used here. So what I'm going to do now is we're going to go straight to the database demonstration. Okay, so we're in the client contact. I'm going to see a client today. This client's name is Coral Gemstone. So Coral is coming into an appointment with me, and the appointment is about domestic violence. So we already know what the presenting issue is, and because of the presenting issue, we are going to screen for strangulation. We are also going to screen for sexual choking because we know that sexual choking and strangulation in the context of violence can often co-occur. And we would also screen for sexual violence as well. Now, when I screen and I ask Coral about if she's had these experiences, she tells me that she has experienced strangulation. So what I would be doing, because that's a positive screen, is I would also be providing a strangulation assessment. Okay, if you are a staff member who doesn't provide that assessment and you provide a referral, you wouldn't be adding this option, you would just be providing that internal referral. So obviously from that assessment, I provide an external referral and counselling. Before I finish up the data collection, because there was a positive screen and because in this session we talked about, we worked with the client to address her needs related to strangulation, strangulation is also a presenting issue. So it also means, for example, if Coral was to come back in a week's time and we were to discuss and I was to provide further referrals relating to her experience of strangulation, I would also click presenting issues as strangulation as well, because again, in that session we were working with a client to address her needs related to strangulation. Okay, so that's done, and there's an example of how we can input that data. Now, what that data looks like and what that means for us when we do a report is like this. Now, obviously, it doesn't come out of the Women's Health Database in the colors and set out in the table here, but what we can get from the data that the Women's Health Database gives us is we can get the number of women that were screened. So, for example, in the first 3 months of this year, 7 women were screened for sexual choking, and 2 women had an assessment for sexual choking. So what that tells us is that 7 women were screened for sexual choking, 2 women disclosed that they engaged in sexual choking, making it 28% of women screened for sexual choking disclosed engaging in sexual choking. Again, we can use the numbers here for the screening and assessment for strangulation to give us this information that 60% of women screened for strangulation disclosed experiences of strangulation. How the presenting issues is going to help us understand women's experiences and particularly the healing journey and the services required for them is we're going to look at the number of women who disclose strangulation and sexual choking, and then we're going to compare that to the number of times in which we provided support in a session related to their needs around their experiences of strangulation and or sexual choking. So you can see here that for presenting issues, okay, we had two times in which we provided support to women who are engaging in sexual choking. And we have 2 women who disclose sexual choking. So what that tells us is, on average, women who disclose engaging in sexual choking attend 1 session where the service provider worked with them to address their needs related to sexual choking. In comparison, you can have a look again here, and again, these are fictional. For the strangulation, it's 24 occasions where strangulation was a presenting issue. So if we have 6 women who have disclosed, that's an average of 6 sessions per woman where the service provider worked with them to address their needs related to strangulation. So that's how we're going to utilize that data. We'll also be utilizing the number of women who have experienced who have acquired brain injury or a traumatic brain injury as well. So they're the latest options that are going to be added in the latest update for the Women's Health Database. If you're a centre who is yet to do round 3 of training and yet to implement your protocol and referral pathway, Scott will be in touch to update your database or your Women's Health Database. If you're a centre that doesn't utilise the Women's Health Database, we will be in contact to discuss how you're going to do that, and that will be a key topic before implementation as well. I hope this was helpful. Please let me know if there are any ways that I can support you in ensuring that there is staff compliance when it comes to data input. Okay, it's a really essential part. We already know that we really have quite a small time frame between our reporting period and actually collecting the data, considering that the final centre will not implement until the 31st of the 31st of March. So that gives us a 3-month window before we can, a 3-month window for data. Okay, thank you very much. Bye.